We're tackling point-of-service plans, or POS plans, and exclusive provider organizations, known as EPOs, for your health insurance licensing exam. Think of a POS plan as a hybrid, mixing features of an HMO and a PPO. Like an HMO, it requires you to select a primary care physician, or PCP, who acts as a gatekeeper. For all-in-network care, you must get a referral from your PCP to see a specialist. The exam loves to test this gatekeeper rule. If a POS member sees an in-network cardiologist without a PCP referral, the claim will be denied. However, the POS plan also has a PPO-like feature, the freedom to go out of network. This is the point-of-service decision. If you go out of network, you don't need a referral, but your costs will be significantly higher, with a separate, larger deductible and lower coinsurance coverage. A classic exam question might describe a client who wants a PCP to coordinate their care, but also wants the option to see an out-of-network specialist for a second opinion. The correct answer is the POS plan. Now let's look at exclusive provider organizations. The name tells you the most important rule. You must use providers exclusively within the plan's network. With an EPO, there is generally no coverage for out-of-network care, except for true emergencies. This is a critical point the exam will hit hard. Where it differs from an HMO is that an EPO does not use a gatekeeper. You do not need a PCP, and you do not need referrals to see specialists, as long as they are in the network. This gives members more freedom and direct access to care compared to an HMO. The exam will try to trip you up on the key differences between these two, and with HMOs and PPOs. The two biggest factors are always the gatekeeper and out-of-network coverage. A common trick question will present a scenario where a patient self-refers to an in-network dermatologist. It will then ask which plan would cover this. Both an EPO and a PPO would, but an HMO or a POS plan would not, because they require a PCP referral for in-network specialists. If the question adds that there is no out-of-network coverage, the answer narrows down to the EPO. Here's a simple way to keep them straight for the exam. For an EPO, remember exclusive provider access is open. This means you are stuck in an exclusive network, but access to those providers is open because you don't need a referral. For a POS, think point of selecting your path, either the in-network path coordinated by your PCP gatekeeper or the more expensive out-of-network path. To recap for exam purposes, POS means PCP gatekeeper for in-network care, with an option to go out-of-network at a higher cost. EPO means no out-of-network coverage, but also no gatekeeper required for in-network specialists. Master the relationship between the gatekeeper and the network, and you will master these questions on test day. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.